My name is Elena Sinkovskaya. I'm an associate professor of obstetrics and gynecology in the Division of Maternal-Fetal Medicine at the Eastern Virginia Medical School. And in this presentation, we review the applications of superb microvascular imaging for evaluation of the human placenta. The placenta is probably one of the most important organs in the body. It influences not just the health of the mother and her child during pregnancy, but also the lifelong health of both mother and child. Despite its importance, we know a little about this critical but temporary organ. A few years ago, the NIH launched the Human Placenta Project as a collaborative research effort to understand the role of the placenta in health and disease. HPP aimed to develop the new tools to study the placenta in real time to learn how it develops and functions throughout the pregnancy. As an NIH HPP grant recipients, we have collaborated with Canon to explore the performance of the new tools in the assessment of the placenta in vivo. As you can see on this slide, the equipment from Canon has plenty to offer for comprehensive assessment of the placenta. We have tools for tissue structure evaluation, evaluation of vasculature, biometry measurements, and assessment of the presence of calcifications. But in this presentation, we will focus on the assessment of the vasculature using the new tool called the Superb Microvascular Imaging, or SMI. An advanced Doppler technique that enables visualization of the microvasculature. The advantage of SMI over other Doppler modalities, such as the ADF, color, or power Doppler, is that it allows the visualization of the smallest vessels with the very low velocities of the blood flow, minimal motion artifacts, and at the same time maintains high resolution and high frame rate. Here you can see the example of application of the SMI technology for evaluation of the anterior placenta on the fetus at 28 weeks gestation. On top of the image, we can see multiple spiral arteries representing the maternal circulation, and here on the bottom, multiple placental fetal arterioles. Of the fetal and maternal vessels within the placenta by SMI guides the appropriate placement of the sample volume of the spectral Doppler for recordings of the waveforms in these vessels and consecutive quantitative assessment of the spectrum so that we can calculate different parameters including the peak systolic velocity and the pulsatility index. We studied the blood flow in the spiral artery using SMI technology in 81 complicated pregnancies longitudinally between 12 and 37 weeks gestation. As you can see here, the pulsatility index decreases significantly until 20 weeks with no significant change after 20 weeks gestation. Our study also showed that in vivo assessment of the spiral arteries throughout gestation by SMI is feasible. The changes in the pulsatility index confirm its transformation by trophoblastic invasion of smooth muscle layer, which seemed to be completed by 20 weeks gestation. Vascular remodeling results in significant reduction in the spiral artery peak systolic velocity with advancing gestation, an important protective mechanism of placental tissue. Develop longitudinal nomograms of the spiral artery's pulsatility index and the peak systolic velocity can be used as the framework for future research of complicated pregnancy. We also performed assessment of the blood flow in the fetal placental arterioles longitudinally. As you can see here, the pulsatility index in the fetal placental arterioles decreases throughout gestation, with a more significant decline in slope in the third trimester. We concluded that in vivo assessment of the fetal arterioles throughout gestation with SMI is feasible. Reduced impedance of the fetal placental bed is noted in early gestation and continues throughout the pregnancy with an accelerated drop noted in the third trimester. Also, the peak systolic velocity in the fetal arterioles increases throughout gestation, and this process is driven by the reduction of the fetal placental arterioles impedance along with the increased fetal cardiac output. Developed longitudinal nomograms of the fetal arterioles pulsatility index and peak systolic velocity can be used as the framework for the future research in particular in complicated pregnancies. SMI technology offers an additional tool for quantitative assessment of the vasculature within the placenta. This is a vascular index. Vascular index can be calculated automatically from the image, and this represents the percentage of the vascular component within the given area of the interest. SMI presents a very valuable tool for assessment of the structural anomalies of the placenta. Here you can see the case of the accessory lobe of the placenta. SMI allows us to highlight the cord insertion in the main placental mass as well as the connecting vessels to accessory lobe. Here is an example of another very common finding within the placenta, in particular in the second trimester of the pregnancy. This is the placental lake. Identification of the blood flow within this hypoechoic structure helps to make the diagnosis of the placental lake and make the differential diagnosis of the other structural abnormalities of the placenta. And finally, SMI technology is very helpful in assessment of the placental masses like chorioangioma presented here. We can clearly see the level of the vascularity of the mass, which correlates very well with the pregnancy outcome and impact on the cardiovascular system of the fetus. In conclusion, I would like to leave you with the take-home message that the superb microvascular imaging is a novel non-invasive ultrasound tool that allows visualization and the quantification of the placental vasculature and its remodeling in the pregnancy adaptation. I hope that you will explore what this technique can do for you in the everyday clinical practice, and I would like to thank you for your attention.